Our scenario today is a 38-year-old woman presenting to the gynecologist's office with the following signs and symptoms. Okay.
Hi, Ms. Davis. My name is Deidre, and today I'm your nurse. What needs to bring you to the doctor's office today?
I've been having lower back pain, lower back and abdominal pain. It hurts when I have sex. I have heavy and irregular periods.
Okay. Ms. Davis, I'm sorry you're feeling so bad. We need to determine the cause of these symptoms that you are having. I have a few questions for you that will help making a diagnosis today. Okay? How many sexual partners have you had?
I had like 5.
Okay. Do you have any burning or itching when you urinate?
Some, yeah, sometimes.
Okay. Are you having any discharge?
Yes.
Okay. This is important when determining if you have a pelvic inflammatory disease or endometriosis. And pelvic inflammatory patients often have multiple sex partners, and with endometriosis, that is not usual a common factor. Okay, I'm going to explain to you what is endometriosis and pelvic inflammatory disease. Endometriosis is when the endometrial tissues implantation outside the uterine cavity. This tissue typically appears on the ovaries and the cul-de sac, less common on other pelvic organs and structures, and that occurs in women ages 30 to 40. The pelvic inflammatory disease occurs in women younger than 26. It's a complex infection process in which organisms from the lower genital tract migrates from the endocervix upward through the uterine cavity into the fallopian tubes.
So will I be to have kids again?
It's a possibility.
Okay.
The similarity of these is where the most common symptom is pain, and it may cause infertilization. Okay. We're going to do a pelvic exam on you, and we'll also do a transvaginal ultrasound to determine if they're in a visible mass, if they're malignant or require further testing. And we'll also do lab work on you. And while doing the pelvic exam, we're going to do a swab to get a sample of any discharge you are having. And we'll also check your white blood count to see if you're having an infection. Thank you, Ms. Davis. The doctor will be in with you shortly.
Hey, Miss Davis, how are you? Good, good. Well, I have just a few questions for you before I tell you what we found. Now, you said you had some vaginal discharge. Can you tell me more about that?
I don't know if it's a discharge or it may just be, I just spot before my period come on. So it may just be a little
Just spotting in between? Okay. That sounds good. Okay. Well, during your pelvic exam, I noted that you were really tender, and it also showed some nodules in the posterior vagina and limited movement of your uterus. The vaginal swab showed no signs of infection, so that's good. And you have an elevated CA25, which is your blood work, which is indicative of endometriosis. Do you have any questions?
So will I be to have kids again, or
Okay, let me go over some
what can I
options.
get to help?
Okay, let me go over some options with you. Non-surgically, we can give you oral contraceptives, and that will help balance your hormones. It might make your periods lighter or maybe even go away. Low level of heat applications to your back or your abdomen, that might help with some of the discomfort that you're having as well. Surgically, we can do a procedure called an ablation, which will remove excess body tissue and help treat the abnormal bleeding. This procedure destroys the uterine lining or endometrium, and another option would be a hysterectomy.
No, I don't want
You don't want a hysterectomy?
because I do want kids.
Okay, good, good. Well, I'll let you think about your options. You can go talk to your husband, decide what you want to do, and you let us know as soon as you can.
Well, do you think if you put me on the birth control now, it'll help me with some of the pain and some of the discharges?
I do.
And then I know I want to continue to have kids, so
That might be the best option for you.
okay.
Okay.
Thank you.
Thank you.